So, anxiety. I think a lot of things can make me anxious. I've been diagnosed with an anxiety disorder in the past. But looking back on like therapy worksheets and things I've done, it seems like that some of the things that make me anxious are not being able to act out on my compulsions, um, the possibility of having to see a reminder of a trauma, anything where I might fail. Fear of failure is a huge trigger for anxiety for me. So, like, midterms ended up being really stressful. Um, the possibility of being late is another big trigger for my anxiety, or what if someone's mad at me, or what if I get fired. Some of the ways I've learned to deal with this include doing this thing I learned when I was in treatment called an ARC, which is really similar to like a behavior chain analysis from DBT or an ABCDE from CBT. That's a lot of letters. But it kind of helps figure out like what was the event that triggered the anxiety, what are my thoughts, my physical sensations, such as heart palpitations, and then my behaviors and urges, and what are the consequences of those. I also go to therapy. I practice mindfulness, and that doesn't necessarily make the anxiety go away, but it does help me get better at realizing what's going on, like what are my thoughts. I also do a lot of thought reappraisals. So I ask myself whenever I have a mean thought about myself, like, you're going to fail this class. I'll just be like, what could also be true? I could get an A in this class. I could drop out. There's a whole lot of things that could be true. And those are the biggest things. I also sometimes fall back on like my old mood dependent behaviors, such as like emotional avoidance by scrolling through TikTok or shopping or sleeping. But I'm really proud of myself because I utilize those behaviors a lot less. Another Some of the newer coping skills that I'm still learning how to use would be I don't know that I'm learning new ones. It's more that I'm actually using them for a change now. Like I'm actually doing the exposures and being vulnerable in therapy. Like cognitively, Emily knew she should do that. OCD, Emily did not comprehend that. So being vulnerable and being able to reach out has been like one other way I cope with anxiety, along with journaling or coloring or just taking a break, even if it's like 5 minutes while I'm doing my notes and like dancing to one song to get some of the energy out so that I can focus better.